For people with sleep apnea who are uncomfortable with sleep masks, a new surgical alternative.
Sinai is now implanting patients with Inspire therapy, and it really is changing lives of patients with sleep apnea for the better. This is an alternative for patients that have significant sleep apnea that don't tolerate the CPAP machine. It is a mask that uses air pressure to keep the airway open. But about half of patients can't tolerate it, half of patients can't stand the use of it. Inspire therapy is exciting in that it basically targets the areas that are actually closing off and obstructing, basically the base of the tongue and the tissues in the throat, and opens those tissues up while you're sleeping. 3 incisions, one along the neck, where we basically find the nerve of the tongue, one along the right upper chest area where the implant's actually placed, and then a small incision along the lower rib area where we basically put a sensor that measures breathing. And so all those 3 are connected. When the patient's asleep, they turn it on with a remote and it senses breathing. So when the sensor senses the breath coming in, it sends a signal to the implant then sends a signal to the nerve, and it pulls the tongue forward as you're trying to breathe in. And so this happens over and over again throughout the night and basically maintains your airway as you're sleeping. After the surgery, you go home the same day. There's no real major restrictions. You can do normal activities, you're able to go back to work fairly quickly. Patients rave about their better quality sleep. The bed partners are extraordinarily happy that their snoring is either completely gone or very, very minimal. And they just, again, feel like they have more energy during the day.